We are back with Dr. Cardi Taub. She's the cardiologist and clinical integration officer for the Cone Health Center for Health Equity. We're talking to her about heart health, specifically in women. So let's talk about the signs and the symptoms of heart disease that are different in women than they are in men.
So I'm going to start by telling you that women can also have chest pain. And the same typical chest pain we talk about with the elephant sitting on the chest and, what we see on Hollywood. But what I really want people to understand is most women will not have that Hollywood sign. People will come in with shortness of breath. People will come in just having tiredness over days. People will come in sometimes. I read something today actually on LinkedIn from one of our cardiology colleagues who wrote that her patient actually had an MI and the only symptoms was back pain. So there's variety of ways that women can come in. But what I want providers to understand and the women to understand is when you are not feeling your right self, ask for help. Get help. If it's prolonging, please come to the hospital. Please get checked out because it could be something that you're sitting on that could be devastating if you don't get it checked out.
Yeah, don't
So,
just pass it off and say, I know I don't
yeah.
feel right, but I'll be fine.
Yeah. And we women, we take care of a lot of other people. We take care of our family members, our children. I'm a victim of that too. I have two daughters, and usually I'll say, oh, you know what? I'm having a headache. I'll just wait. But no, make sure that you are cared for because that's important. You want to come in and that's what we're talking about prevention because you want to make sure you're knowing those numbers. You want to make sure you have a blood pressure cuff at home. You can be able to check that. And you want to make sure that you're checking out things that are not within your normal baseline.
Okay, besides the taking your blood pressure, what other prevention steps should women do to reduce their risk for heart disease?
So there are a few things, and you can be guided by what we call the American Heart Association Life Simple 8, but I'll just tell a few things. So one is eating healthy. Talking about the colorful plate. I'm not talking about the colorful plate with cheesecake and pineapple upside down cake or chocolate cake and looking at the different colors. I am talking about fruits and vegetables, making sure you have lettuce, making sure you have the carrots, making sure you have your protein, making sure you have your fruits, blueberries, strawberries, a lot of different things that are healthy. The second thing is you want to keep active. I'm also encouraging people that to challenge yourself. Don't park near it to the nearest parking lot next to the elevator or next to the door. You want to park further. The little you do, the better it gets for you. If you're able to take the stairs, take the stairs, not the elevator. Secondly, we talked about knowing your numbers. I can't stress that enough. You can only be your own pilot or your own navigator if you know your numbers. So if you know that your blood pressure number should be less than 130/80. If that's high, you can do something about it. If you know your cholesterol numbers are high and if you're looking at that number is out of the range, you want to talk to your provider about it. If you know that your numbers are high for your hemoglobin A1C, ideally it should be less than 5.8. And if you're 5.8 and over, that's pre-diabetes. If you're over 6.5, you actually have the diagnosis of diabetes. You also want to make this a family affair. You want to encourage your kids at a younger age to start eating healthier and start being active so that way when they grow up, they're able to do it. One last important thing is you want to make sure that you're sleeping well. You want to make sure that you're getting at least 7 or 8 hours sleep. You're managing your stress as well. So all those things can be important.
All right, thank you so much. You gave us a whole lot to think about. Maybe you need to be watching this with somebody else in your family. This is going to be in the To Your Wellbeing section of our website, WFNYnews2.com. We'll be right back.